A hernia is a hole or a defect in the strength layer of the abdominal wall that allows any contents that are from one cavity to then go into another cavity. So for example, it could be bowel or fat that's inside our belly that then protrudes out and we feel it out underneath the skin. So we call that hernia. The symptoms of a hernia can be very different. Some patients present with no symptoms at all and the hernia is found on imaging incidentally, versus others having mild pain discomfort to severe pain discomfort, and others actually having bowel blockage that brings them to the emergency room. There are two groups of people that do have hernias that I think of. One are people who have a hernia at birth, and so it could be detected when they were very small kids and a pediatric surgeon could have fixed it, versus adults that did not know they have it or they didn't have symptoms, so they left it alone and they come to us after they've grown up. And those could be what we call hernias that were present at birth. Others would be hernias that patients get as they were living life, and so it could be related to surgery that they've had, so the hernia exists in the site of the scar or incision that they've had before. Others could be patients that lift a lot of heavy objects, can sometimes get hernias in their groins or even belly button hernias, so those are hernias people get as they age. Not all hernias are the same, and so there are different kinds of hernias. The most common hernias are what we call groin hernias, and a lot of times we see this in patients that do lift a lot of heavy objects, and so they put pressures in the spaces that normally exist at birth but never closed very well and could give them groin hernias. Other ones could be belly button hernias, where the baby used to be attached to their mother. That might not have closed very well after they were born, so they could see a hernia as an adult. Other ones would be what we call incisional hernias, or hernias that come secondary to a prior hernia surgery site. Other ones are flank or back hernias. Those also could be related to prior surgeries, but actually patients can have natural spaces that then have contents of bowel that go through them and causing a hernia afterwards. Well, this is a good question. Do all hernias need surgery? And the key thing to remember is once somebody gets a hernia, the hernia doesn't heal on its own. Most of the time, the natural course of it will be the hernia in few people might stay the same, or in most cases that we see, it gets larger as time goes on. And so not all hernias need immediate repair, but majority of them do require some kind of repair down the road. And the reason for that is most hernias have a risk of having either bowel or fat that's going to be stuck in them. So that could turn something that is a mild discomfort initially for a patient into an emergency afterwards where they have to be operated immediately. So we do tell people, in discussion with your surgeon, a good plan to get your hernia fixed before it turns into an emergency is what's the best way to do it. There are various ways to fix a hernia. The two categories, broad categories I can say is a hernia can be fixed with small incisions, or what we call minimally invasively, or it can also be repaired open. Each of them have their own benefits, advantages and disadvantages, and some hernias are very appropriate for small incision operations and some hernias are not. So it's what really fits the hernia in terms of which operation is needed. In terms of the small incision operation, we can either do them laparoscopically or with small instruments that we put into reports, or we can do it robotically, which basically is a software enhanced way that gives us more ability to actually fix hernias that might be harder to access laparoscopically alone. The recovery time after surgery can be very different from one operation or one type of hernia versus another. For typically, as an overall, for most hernias, the recovery time for patients is between 1 to 2 weeks after surgery. Almost all patients, or most patients, will have some kind of a weight lifting restriction. In most of them, we limit about 10 to 20 pounds of weightlifting restriction for about 6 weeks, which allows the hernia to heal really well before we actually put pressure on the area that has been fixed. And so 1 to 2 weeks is a usual thought process of how long it takes most hernia patients to recover. Yeah, questions about mesh is one of the most common discussions I have with most patients because they tend to see things on TV regarding meshes. But meshes basically are synthetic materials that are woven together to allow to be put in spaces where the hernia was fixed, so that we can reinforce the strength of the abdominal wall so that it's able to decrease the chances of the hernia coming back. It is not a replacement for the natural tissue, but it does a very good job of making sure that in an area where it's weak from the hernia to begin with, after it was sutured, it gives it another layer of strength to be able for that repair to last longer for the patients. If you have any questions about whether you have a hernia or not, maybe you've had a discussion with your primary care physician or other physicians about taking care of a hernia that you know about, please reach out to the Marshall surgeons that are very adept in fixing hernias and all the different techniques I talked about.